Understanding and Addressing Clogged Arteries. A comprehensive guide to cardiovascular health. The human cardiovascular system is a marvel of engineering, responsible for circulating oxygen-rich blood to every cell, tissue, and organ in the body. However, this intricate network of arteries, veins, and capillaries is not immune to dysfunction, with one of the most common issues being the buildup of plaque within the arteries, a condition known as atherosclerosis. In this video, we drill into the causes, symptoms, risk factors, and treatment options for clogged arteries, shedding light on this pervasive health concern and empowering individuals to take proactive steps towards cardiovascular health and well-being. Understanding clogged arteries. Atherosclerosis is a progressive condition characterized by the accumulation of fatty deposits, cholesterol, calcium, and other substances within the walls of the arteries, leading to the formation of plaque. Over time, this plaque buildup narrows and hardens the arteries, restricting blood flow to vital organs and tissues and increasing the risk of cardiovascular events such as heart attack and stroke. Causes of clogged arteries. High cholesterol. Elevated levels of LDL, low-density lipoprotein, cholesterol, commonly known as bad cholesterol, contribute to the formation of plaque within the arteries. LDL cholesterol can oxidize and become trapped in the arterial walls, triggering an inflammatory response and the accumulation of plaque. High blood pressure. Hypertension, or high blood pressure, places excessive force on the arterial walls, causing damage and inflammation that can lead to the development of atherosclerosis. Chronic hypertension accelerates the progression of plaque buildup and increases the risk of complications such as heart attack, stroke, and peripheral artery disease. Smoking. Cigarette smoking damages the endothelial lining of the arteries, making them more susceptible to the accumulation of plaque. Smoking also promotes inflammation, vasoconstriction, and oxidative stress, exacerbating the progression of atherosclerosis and increasing the risk of cardiovascular events. Diabetes. Diabetes, particularly type 2 diabetes, is associated with insulin resistance, dyslipidemia, and chronic inflammation, all of which contribute to the development of clogged arteries. Individuals with diabetes have a higher risk of atherosclerosis and cardiovascular complications, emphasizing the importance of blood sugar control and lifestyle management. Sedentary lifestyle. Lack of physical activity and sedentary behavior are significant risk factors for the development of clogged arteries and cardiovascular disease. Regular exercise helps improve circulation, lower blood pressure, and reduce LDL cholesterol levels, mitigating the progression of atherosclerosis and supporting overall cardiovascular health. Symptoms of clogged arteries. The progression of atherosclerosis is often asymptomatic in its early stages, with symptoms typically manifesting once the arteries become significantly narrowed or blocked. Common symptoms of clogged arteries may include chest pain or discomfort. Angina is a common symptom of coronary artery disease, characterized by chest pain, pressure, tightness, or discomfort that may radiate to the arms, neck, jaw, or back. Angina occurs when the heart muscle does not receive an adequate supply of oxygen-rich blood due to narrowed or blocked coronary arteries. Shortness of breath. Dyspnea, or shortness of breath, may occur during physical exertion or at rest due to reduced blood flow to the lungs caused by clogged arteries. Individuals with severe atherosclerosis may experience difficulty breathing, wheezing, or coughing, especially when lying flat or engaging in strenuous activities. Fatigue and weakness. Reduced blood flow to the muscles and organs can lead to feelings of fatigue, weakness, and lethargy, even with minimal physical activity. Chronic fatigue may be a sign of systemic atherosclerosis and underlying cardiovascular disease, warranting further evaluation and intervention. Dizziness or lightheadedness. Reduced blood flow to the brain can cause dizziness, lightheadedness, or fainting spells, particularly when standing up quickly or exerting oneself. These symptoms may indicate carotid artery disease or cerebral artery stenosis, both of which can increase the risk of stroke and cognitive impairment. Erectile dysfunction. Erectile dysfunction, or ED, may be a symptom of underlying vascular disease, including atherosclerosis of the penile arteries. Impaired blood flow to the genitals can interfere with normal erectile function, leading to difficulty achieving or maintaining an erection. Risk factors for clogged arteries. In addition to the aforementioned causes and symptoms, several risk factors increase the likelihood of developing clogged arteries and cardiovascular disease. These include age. The risk of atherosclerosis and cardiovascular events increases with age, particularly after the age of 45 for men and 55 for women. Aging is associated with changes in blood vessel structure and function, as well as cumulative exposure to risk factors such as hypertension, dyslipidemia, and oxidative stress. Family history. Genetics plays a significant role in the development of atherosclerosis and cardiovascular disease, with a family history of heart disease increasing the risk for future generations. Inherited conditions such as familial hypercholesterolemia and familial combined hyperlipidemia predispose individuals to elevated cholesterol levels and premature atherosclerosis. Diet and nutrition. Poor dietary habits, including high intake of saturated fats, trans fats, cholesterol, and sodium, contribute to the development of clogged arteries and cardiovascular disease. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats supports cardiovascular health and reduces the risk of atherosclerosis. Obesity. Excess body weight, particularly abdominal obesity and visceral fat accumulation, is a major risk factor for atherosclerosis and metabolic syndrome. Obesity contributes to insulin resistance, dyslipidemia, inflammation, and endothelial dysfunction, all of which promote the progression of clogged arteries. Stress. Chronic stress, anxiety, and depression are associated with increased levels of cortisol, adrenaline, and inflammatory cytokines, which can damage the arterial walls and accelerate plaque formation. Stress management techniques such as meditation, mindfulness, and relaxation exercises may help mitigate the impact of psychological stress on cardiovascular health. Treatment and prevention of clogged arteries. The treatment and prevention of clogged arteries involve a multifaceted approach aimed at addressing underlying risk factors, reducing plaque buildup, and optimizing cardiovascular health. Treatment options may include lifestyle modifications. Adopting a heart-healthy lifestyle is the cornerstone of preventing and managing clogged arteries. This includes following a balanced diet low in saturated fats, cholesterol, and sodium, engaging in regular physical activity, maintaining a healthy weight, quitting smoking, and managing stress. Medications. Medications may be prescribed to lower cholesterol levels, control blood pressure, manage diabetes, and reduce the risk of blood clots. Commonly prescribed medications include statins, beta blockers, ACE inhibitors, diuretics, antiplatelet agents, and anticoagulants, among others. Medical procedures. In cases of severe atherosclerosis or coronary artery disease, medical procedures such as angioplasty, stenting, or bypass surgery may be necessary to restore blood flow to the affected arteries. These interventions are typically reserved for individuals with significant narrowing or blockage of the arteries that cannot be adequately managed with lifestyle modifications or medications alone. Cardiac rehabilitation. Cardiac rehabilitation programs provide structured exercise training, education, and support for individuals recovering from cardiovascular events or procedures. These programs help improve cardiovascular fitness, reduce risk factors, and enhance overall well-being, empowering individuals to lead active and fulfilling lives. Preventive measures for clogged arteries. In addition to medical treatment, several preventive measures can help reduce the risk of clogged arteries and cardiovascular disease. Know your numbers. Monitor your blood pressure, cholesterol levels, blood sugar, and body weight regularly to identify any underlying risk factors for cardiovascular disease. Work with your healthcare provider to establish target goals and develop a personalized plan for prevention and management. Eat a heart-healthy diet. Choose a diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats such as omega-3 fatty acids. Limit your intake of saturated fats, trans fats, cholesterol, and sodium, and avoid processed and highly refined foods that contribute to inflammation and plaque formation. Exercise regularly. Engage in moderate-intensity aerobic exercise such as walking, cycling, swimming, or dancing for at least 150 minutes per week. Incorporate strength training exercises 2 to 3 times per week to improve muscle tone, bone density, and metabolic health. Maintain a healthy weight. Aim for a body mass index, BMI, within the normal range, 18.5 to 24.9 kilograms per square meter, and strive to maintain a waist circumference below 35 inches for women and 40 inches for men. Focus on gradual, sustainable weight loss through a combination of dietary changes, physical activity, and behavior modification. Manage stress. Practice stress management techniques such as deep breathing, meditation, yoga, or Tai Chi to promote relaxation and reduce the harmful effects of chronic stress on the body. Prioritize self-care activities and seek support from friends, family, or mental health professionals when needed. Get regular checkups. Schedule regular visits with your healthcare provider for preventive screenings, health assessments, and monitoring of chronic conditions. Be proactive in discussing your cardiovascular health and addressing any concerns or symptoms that may arise. Clogged arteries pose a significant risk to cardiovascular health and well-being, affecting millions of individuals worldwide. By understanding the causes, symptoms, risk factors, and treatment options for atherosclerosis, individuals can take proactive steps towards prevention, early detection, and management of this pervasive health concern. Through lifestyle modifications, medical interventions, and preventive measures, we can optimize cardiovascular health and reduce the burden of clogged arteries on individuals, families, and communities alike. Let us prioritize heart-healthy habits, empower individuals to make informed choices, and work collaboratively towards a future where heart disease is no longer the leading cause of morbidity and mortality worldwide. If you received value from this video, please like and subscribe to the channel.